So we'll do some internal and external rotations to activate the rotator cuff muscles, the infraspinatus, teres minor, and subscapularis, which are 3 of the 4 rotator cuff muscles that are very important for shoulder stabilization during exercise and especially during intense sports. One important point is that activation and strength are very different. Activation is waking up the muscle, turning it on, like turning on the light switch, getting the nervous system to keep the muscle working. Strength is when you actually change the structure of a muscle, increasing the density of the cells, increasing the size of the cells. So in order to create strong muscles, you need to activate ones that especially that are underactive or weak. I'm gonna have Jessica turn around for us, so go ahead. And so she's gonna be working her left arm right now. So the anchor is gonna be on that side. You can use a cable machine or any sort of bands. And what she's gonna aim to do is the infraspinatus is right here, the teres minor is just below it. Again, these muscles are gonna help keep the shoulder back and open. So you may have seen this before. All she's gonna do is basically rotate her arm out. So go ahead. And you can see these little muscles popping out here. Go ahead. So the deltoid, which kind of sits on top, it covers the rotator cuff a little bit. But you can see them. And the rotator comes all the way around here and it helps keep the head of the humerus, the ball, in the socket of the shoulder. So some things to consider when she's doing this is you don't want to kind of collapse. A lot of people will bend this way as a way of kind of compensating, cheating a little bit. So you want to keep your posture, your shoulders even. So you want to also keep her body upright without arching the lower back. Elbows should stay into your body, right even with your body, and then go ahead, going, and hold that right there. And you can see everything is firing here well. So there's a lot of detail in this exercise that sometimes gets overlooked. So often what you'll see is the head of the humerus, the ball, pointing forward, and the elbow back. So to counteract that, keep the arm a little bit here, almost err on the side of bringing it too far forward. And then for some people, they want to bring the shoulder down, so depress your shoulder. Yeah. And then, so that's kind of what we're traditionally taught, is that you want to keep the shoulder down and back. That's not always the case. I've had a lot of situations with clients where the shoulder actually needs to be a little bit elevated and retracted that way. So it's not always so simple. So what you can do if you're doing this on your own or with a physical therapist, you can modify and you can kind of try different angles to see which one works for you. If you have rotator cuff pain or any pain or injuries in the shoulder, you can try these different options. So with that in mind, I'm gonna have you elevate the shoulder and then draw the shoulder blade back, okay? And you can see how the head of the humerus, a little bit more, is sitting backwards. It's not pointing forward like that, right? So go ahead and rotate out. So you have a lot of stability here. And with any exercise, just be careful not to arch the lumbar spine. Go ahead. So people will oftentimes do that just as another compensation, either as a way of kind of avoiding doing the movement properly or just because that's kind of normal to the posture. So you just want to try to keep the belly button drawn in, stand up nice and tall, chest out. And with all these activation exercises, you want to do them slowly. Go ahead. Hold it at the end for a second for like a 1 count. And you want to do about 10 to 15 repetitions, 1 to 2 sets.